Hi, I'm Katie Black, and today I'm going to be talking to you about voluntary service organizations, aka nonprofits, and some money issues that can come up when you work for a nonprofit, get assistance from a nonprofit, or even start your own nonprofit. So, today I'm going to start by giving you some basic background information on these organizations and their main characteristics, and then we'll dig into the issues I found when I went sorting through the newspapers. So, the first thing I wanted to talk about was how these nonprofits fit into the mixed welfare economy. So, we call it the mixed welfare economy because it's truly a mix of public sector and private sector. So, in the public sector, we have the government and all these government programs that people can go to get aid, right? It might also include the education system, these public things that are run by welfare bureaucrats, right? Politicians over here. Then we have the private sector. And the private sector has two parts. So the private sector not only has our nonprofit organizations, but they have private practices too. And more, as we'll see when we talk about the articles that I read, these two things are becoming more and more alike. The main difference being one is supposed to be generating a profit and one is not. So let's look at some common characteristics you'll see when you're looking at nonprofits. I myself have worked at many nonprofits. I did a volunteer program that allowed me to work with 6 to 8 in 1 year. And I've noticed that a lot of these characteristics really are common when you get out into the world. So let's look at the first one. So the first one says that nonprofits are often going to serve those populations that are sort of stuck in the middle, right? So the people don't meet eligibility for government programs, but they also can't provide these services for themselves. So the nonprofits seek to get at this area in between. So a good example of this that a good example of this in a nonprofit that I've worked for is DC Central Kitchen. They cook meals and give meals to both groups and individuals, and they also provide culinary classes. They don't have the eligibility requirements of food stamps. Um, they don't have the same requirements as grants and aids and things like that. So they really fill that space and they feed people who aren't qualifying for financial assistance and food stamps, but also aren't being able to afford to eat on their own, right? Another characteristic of nonprofit organizations is that, historically speaking, a lot of them have served sort of marginalized people, and a lot of them have missions and visions and goals that have to do with social justice. So if you look back at the civil rights movement, like SNCC and a lot of the organizing movements were small nonprofits. A lot of them were also faith-based, and some nonprofits are. And today we still see that tradition happening, right? One of the biggest nonprofits is Black Lives Matter. They haven't been around that long, but they have made millions upon millions of dollars in fundraising and have name recognition that, most groups couldn't even dream of. Another example is Human Rights Campaign, and they are a nonprofit that work towards um, gaining rights for LGBTQ plus people and helping those people protect those rights. So this is really a very traditional type of nonprofit to see out in the world. Other nonprofits might be taking on concerns that don't have enough traction for laws to be passed about them, or perhaps just aren't really a good fit to go that legislative route with it. So the first one I could think of that fit this sort of description was the Make-A-Wish Foundation. It's unlikely that we're ever going to have a law that grants wishes to terminally ill children, right? That's just not something that it seems like we would make legislation for. So the Make-A-Wish Foundation fills that gap. Nonprofits overall are about filling in these gaps. between what the public can do for themselves on a private level and what the government does for the public. They fill the gap. Another example would be Made by Dyslexia. This is an organization that really seeks to highlight the powers of people who are dyslexic and get training for teachers and more evaluations done to catch dyslexia when kids are going through school. There are laws being advocated for on this subject and being worked towards, but they have not passed yet. So this nonprofit is trying to fill in that gap until that legislation can get passed, until it has enough traction to become a law. And finally, especially for our discussion today, this is going to be the most important characteristic, is nonprofits are tax exempt. So they're going to save a lot of money by not having to pay taxes. Now, when you go out as a social worker and you're looking for a job, there are a lot of benefits of nonprofit organizations. I currently work for a nonprofit. I've worked for many, and I enjoy that work very much for a lot of these reasons. A lot of times nonprofits are going to be localized. So they might be tied to a city, or they could be tied to more of a community, like the LGBTQ community or the Black Lives Matter is tied to African American community. So that really focuses things. So the values of the organization will match the values of the community. And the focus of the organization will often be putting concern for those in the community over that personal gain, right? If you're working at a nonprofit and and some people are really thinking more about themselves, you know that there's probably something shady going on. And I have some stories I could tell you guys about that. But nonprofits are also able to alter their programming relatively quickly. So if you want to make a change to your services as a nonprofit, you might have to go through a board and an executive director, but that pales in comparison to the type of bureaucratic red tape that goes into changing a law or a policy or something like curriculum in a school system, right? I worked for a nonprofit that did tutoring and mentoring for homeless children, and we were doing homework help. We quickly realized that homework help is only as helpful as the homework is. And the kids we were working with were not getting great homework. So we could relatively easily change over to an intervention model and work on writing and reading and math with those kids instead of homework help without having to go through a bunch of red tape. But if you've ever worked in the school system, you realize to change the way things are done, it takes decades. It's one of the slowest moving systems there are. So nonprofits are really great to work for because you can really tailor your programming to the needs of your community. You really feel at one with the community. If you guys are doing your job as an organization, you will be out there and it will really have that neighborly feel. Now that we know a little bit about nonprofits, let's look at some of the issues that I found when I looked at the news. So, both of the issues that we're going to talk about today have to do with money, and both of them were at least mentioned in our chapter. The first one they talked about in a little more depth, and that's commercialization of nonprofits. So, you're going to see that a lot of nonprofits are competing within that private sphere with private practices, right? The article we're going to look at today talks about hospitals. So you have nonprofit hospitals competing with for-profit hospitals. And as a result of that competition, a lot of hospitals are taking on similar billing practices as the for-profits. And I've even seen this at my own organization. So we are looking to provide mental health care for children, but all the models we have to work from are really private practice models. So you end up with a very similar animal in the nonprofit and private practice world. In addition to the issue of commercialization coming up in those billing practices, a lot of nonprofits are taking on commercial activities to help fund other initiatives. So, a great example of this is actually going on at my work, where the plan is to sell private team building practices with our horses. To large corporations that need team building activities. So these corporations can pay market value for these services. So we're going to charge them that to then tie into scholarships for mental health care for children that cannot afford it. However, a big argument can be made when nonprofits do these commercial activities, right? So if there was a business that sold team building practices to corporations using horses, they could say, hey, it's really unfair that you guys get a tax exemption to do the same thing that we're trying to do without a tax exemption. So that's where a lot of the arguments come in with nonprofits doing commercial activities. But let's look at our article for today. So this article is from the New York Times, and it is about the Alina Health Care System, which has 100 nonprofit hospitals in Minnesota and Wisconsin. So these nonprofit hospitals were able to avoid $266 million in taxes under the provision that they would give free or reduced cost care to low-income families. Alina Healthcare said, okay, this is our deal. They have financial assistance programs to help many, many people. However, Alina did not let people know when they were qualifying for this financial assistance and would bill them, send them to collections, even sue them at some point. But beyond that, Alina also started to refuse care to patients that had $4,500 or more in healthcare debt. Now, this didn't include the emergency room, but if you had a chronic illness like cancer, you could not schedule your appointment. The schedulers couldn't bypass the system and schedule an appointment for you. Nothing could be done for you until that entire debt was paid. Not just the payment plan, but the entire debt had to be paid before you can get care. And the kicker to this is Alina ended up spending less than 1% on charity care. So they're spending less than 1% of their money on this care, but they are avoiding $266 million in taxes, and they made a revenue of $4 billion. So basically, the care is out there for people who need financial assistance. The financial assistance is there, but they're not telling people, even to the extent where they are suing people and they have never told them that they would qualify for these programs. They had people who qualified for Medicaid still being billed at these full prices. So this is a really good example of a nonprofit billing like a for-profit company. There were numerous articles along these same lines about other healthcare systems. What's funny about this one is that a week later, the New York Times had a second article published about how they were pausing this practice. So I think they did get into a lot of trouble for doing this. But let's look at some of the implications on social work. About what the NASW policy says about all of this. Now, there was no policy in Social Work Speaks specifically targeted towards nonprofits, but I did look at the issue statement and policies around community development, and I found a couple that I think really transfer well to this situation. The first policy statement said that efforts should focus on promoting social justice eliminating structural inequalities, and assuring access to affordable housing and safe neighborhoods, a health environment, and reliable transportation. So I don't think that this policy that Alina Health has is really focusing on assuring access to a healthy environment, right? I think they're directly going against that. So I would say that if I were a social worker working for Alina Health, I would not be very happy with this policy. They are also not working at combating the structural inequality that happens within the private healthcare system. So really, I don't feel like Alina's following this policy at all. The second point that I thought transferred relatively well said that sustainable models of community development protect and promote people and planet well-being while ensuring financial stability. I like this point because I think it's important for nonprofits to be balancing what's going to make them sustainable and have financial stability with working at getting those individual needs met of the people they work for. Now, Alina, they got that financial stability, right? They are sustainable. They made $6 billion or something like that. But they are doing it at the cost of the people that they are trying to protect and give aid to. So they would be definitely not following that policy. And let's look at some of the implications for our practice. Like, what can we take away from this? And for me, I really walked away saying, wow, as a social worker, if I'm trying to help somebody who needs to get aid or needs something from one of our big bulking systems, like the healthcare system or the education system, I'm really going to have to work hard at gathering a lot of information. So in the healthcare system about billing practices and financial aid and the nonprofits that can help fill in the gaps for people who might not be able to get financial aid and might not be able to get some of our government program to help pay for healthcare. Same thing for education. The education system is very bulky and complicated, and it's sort of my personal mission through my nonprofit to help parents navigate that system. So I have to be very hyper aware of what rights parents have, what nonprofits help fill in the gaps that the education system is not filling in. So that knowledge of systems and what's available is going to be a big implication that might take a lot of time for some of us. The other is when we are setting our own payment systems in place. So this is a big conversation at my own nonprofit. How are we going to decide what to charge people? It comes up over and over again, and I'm not sure that we've settled on anything good, but there was guidance in the Code of Ethics in Social Work Speaks. So I went there instead of maybe like the policy issue section. So the Code of Ethics says when setting fees, social workers should ensure that the fees are fair, responsible, and commensurate with services performed. Consideration should be given to clients' ability to pay. It also says social workers should not solicit a private fee or other remuneration for providing services to clients who are entitled to such available services through the social worker's employer or agency. So it feels to me that Alina was not acting ethically when they were not letting their patients know that they qualified for financial assistance. And we as social workers need to keep that in mind when we are setting our own fees. But as you guys know, sometimes you aren't kind of going out on your own and setting your own fees. But you're still going to have to contend with the issue of money if you work for a nonprofit. So salaries are the second issue we're going to talk about today. In our book, it touched on those issues by saying a lot of these super large nonprofits like Bill and Melinda Gates Foundation, they can pay these executives these huge sort of inflated salaries. So in the cases of these giant nonprofits, people are getting rich. I don't think most of us are going to have to contend with the ethics of, you know, making $1 million a year as social workers. However, we are going to have to deal with the fact that nonprofit work is often seen as like intrinsically rewarding, right? We're supposed to do it because we love helping people. And we're going to talk about the martyrdom issue in a second. So, we often are going to face lower pay in nonprofits because of this. And if you're running a nonprofit, you really have to balance salaries versus other expenditures, right? Like, do I want to pay my people maybe their market value or above, or do I want to be able to give this many more scholarships for mental health care? These issues are going to come up. And they're coming up more and more, which is why I was able to find an article about it. So this article is also from the New York Times. It was called "They Want to Change the World. They Would Also Like a Raise." And it talks specifically about this group called Community Solutions, and they were a nonprofit that combated homelessness. Boom, they get a $100 million grant. So there's all this money out there, and the workers unionized because they specifically wanted protections for the formerly homeless that worked in the organization and making sure that they were going to get fair routes to promotions and pay. And it really caused big problems between them and the management. They joined the union, the management, they hired a huge law firm to communicate that way. And it really does create a lot of conflict, although many argue that it's necessary conflict. But in general, the article is talking about this issue where nonprofit employees are unionizing more and more. So the Nonprofit Professionals Employees Union had 700 members just a few years ago, and today they have 1,700 members. So it's growing and growing and growing. People are wanting to be paid what they're worth, right? And people are getting tired of this martyrdom syndrome where it is like you should be a martyr for the cause, and so you shouldn't be asking for raises and to be getting paid a lot, and you should just do it for the greater good. But as we all know, we need to eat and we need to take care of our families, and so people are joining unions. Unions are also working on the issues of transparency in organizations, standardized pay scales, and racial equity. Now, on the management side of this equation, they talked a lot about, scarcity. Like, nonprofits don't have the money that Starbucks and Amazon does to be able to meet the demands of some of their workers, right? That's just a fact. So you're going to have to contend with that if you work for a nonprofit. Sometimes you can be the most qualified, but the answer is going to be no, we cannot pay you that much because we just can't. They just don't have the money. Another issue is that when nonprofits get things like grants, a lot of times they're earmarked for specific purposes. So maybe you get a grant to, I don't know, open a tutoring center, but they don't pay any of that administrative costs of designing it and marketing it and things like that. So some people might not end up getting paid. A lot of times salaries are left out of those earmarks. When people donate money, they want to build libraries or they want to buy food for 500 families, but they don't necessarily want to pay the person who's going to take that food to the families as part of that grant money. So this is a very sticky issue. It's a sticky issue when you work for a nonprofit and you are trying to negotiate your salary. So let's look and see what the NASW policies have to say sort of around this subject. So once again, I looked at the Community Development Policy Statement, and it talked about how if you are going to start a nonprofit or community development project, you need to make sure you have the time and resources to pull it off. So for me, I think if I were starting a nonprofit and I were going to employ social workers, I would want to make sure that my resources were such that I could pay them their market value, right? That my salaries could be comparable as to what's out there in private practices, right? It also says that sustainable models of community development protect and promote people and planet well-being while ensuring financial stability. So we have to be balancing the stability of our organization with what we're doing for the people. So we can't really give up one for the other. It's a hard topic. So then I looked at the Code of Ethics and what it says about payment for services for some guidance. And it says, when setting fees, social workers should ensure that the fees are fair, reasonable, and commensurate with the services performed. Consideration should be given to clients' ability to pay, right? So we need to make sure they're fair. And we need to make sure they're based on an ability to pay. So at my own work, we've talked about sliding scales and things like that to try to meet that code. It also says social workers should not solicit a private fee or other remuneration for services to clients who are entitled to such available services through social workers' employer or agency. So if there's something they can get elsewhere in the agency, you really can't be asking them to pay for it from you. You know, we're going to try to get their needs met at the cheapest way possible. So these are difficult topics. Let's look at your discussion questions. So the first one is very autobiographical. You work at a nonprofit that aims to provide intensive outpatient therapy to children. Your organization is passionate about providing high quality, qualified care to children who would not afford it otherwise. How would you decide on the prices of your services? What factors would you consider when pricing your services? Your organization employs multiple counselors and social workers. You must determine their salary range. What factors would you consider in determining salaries? Would you be willing to raise costs for clients in order to better pay your staff or recruit a highly qualified staff? I'm really excited to hear what you guys think. The second discussion question option I pulled from the New York Times as well. It was somebody who wrote into the ethicist looking for advice. So I'm not going to tell you what they said. I want to hear what you guys have to say about this. So basically, in this situation, a woman switched from a job at a nonprofit whose mission she was passionate about to a more senior role in a different nonprofit sector. She was previously underpaid and now has doubled her salary. Hooray, right? Her new salary is about 20 to 30% higher than comparable jobs at similar organizations. She doesn't feel the job requires her level of experience and they could hire someone cheaper. She meets her job requirements but doesn't go above and beyond. What advice would you give to this woman? Is she doing wrong by using extra resources at a job where she isn't going above and beyond? Can't wait to hear what you guys say. Well, thank you for your time.